Hey, good morning, everyone. This is Ray Langlois. I'm the Coalition Coordinator of the Wilco Wellness Alliance, and welcome to the School Health Working Group meeting. This month we are doing it via webinar because we want to show you a presentation based on the progress so far that the Wilco Wellness Alliance and the School Health Working Group has been making. Uh, we're going to go ahead and record this session. And that way everyone can have access to it later on. We know a lot of people are on vacation and those things, so we'll have that ability to do that. Today I'll be presenting with Melissa Tung, who is Assistant Analyst and the Community Health Improvement Lead for the Williamson County and Cities Health District. So we're glad that you guys could be on this call. We'll have a presentation, and then you can type in questions if you want to in the chat box, or we will have a question at the end of the session. So we're going to go ahead and move forward with the presentation today. Hopefully you can see the screen and everything's going well. The objectives today are to just go ahead and review the top 5 health priorities that are in Williamson County, to give you a mid-year progress update on the Alliance. We're going to give you a community health improvement update, and that really is going to fall into what the School Health Working Group has done over the last 6 months. We'll have room for discussion, and then we'll have next steps as well. So just a reminder to everyone that we're working from our top 5 health priorities in the county. In 2016, the Board of Health of Williamson County and Cities Health District approved our community health assessment. This assessment was conducted with county throughout the county, and they identified mental health, access to health care, awareness of the health care resources, active living, and chronic disease as all health priorities. And then we took that information back to our working groups and worked on our community health improvement plan. That plan was discussed and put together before 2017, and it was approved by the Board of Health in January of 2017. The alignments are shown on your screen at this time of how each of the working groups are working on various aspects of the health priorities. And you can see that school health is working in 2 of these areas, and I'll explain mental health in a second, but they're working in the areas of awareness of healthcare resources and in prevention of chronic disease. And we do have a working group called the Mental Health Task Force, and embedded in the Mental Health Task Force is a smaller segment of the small subcommittee called the Youth Subcommittee, and they work primarily with school behavioral health issues, and they are very, very focused in on the age group of school-age children and families. Those are 2 things that they're very focused in that group subcommittee. So if there's interest in that, you certainly could attend that group, and we can talk about that. The Substance Abuse Collaborative is another group that focuses on youth and issues related to youth, especially in the areas of underage drinking and then underage substance use. So we do cover the behavioral health issues in 2 other groups, so we move those out of our school health working group so that we can focus on other areas of health that might affect families and students in school. So in our mid-year progress update, we're going to talk about at this point just kind of how the Alliance is doing. We started a plan in January of 2017. We work on 3-year cycles with our community health improvement plan, And we feel like it's important to give mid-year checkups, checkpoints, so that people can have an understanding of what kind of progress we're making and what kind of steps do we need to make from there. Just to tell you a little bit about the Alliance membership has steadily grown since January of this year, and we've added 100 members as of June, and it continues to grow even throughout this month. That's a 20% increase, and there's 170 organizations represented there. We really like that level of diversity and the magnitude of the membership. We think that just makes us stronger. And if you look at the working group membership, you'll see that membership is stratified throughout all the working groups. We're very excited about the fact that many of our agencies and organizations that join the Alliance are willing to participate in several working groups. Some of them attend more than one meeting a month, and that really excites us. The school health working group probably has the largest number of people associated with that group, and like I said before, a lot of those attend the school health, or some of them even attend those other two subcommittees I talked about earlier. So very glad to see the amount of participation in this group. And even from the standpoint of meeting participation, the school health working group has the largest meeting participation, averaging about 17 members per meeting. It's a really fun group. It's a diverse group. It's made up of school personnel who work in the ISDs, as well as the outside agencies. It gives them an opportunity to make contact with the school districts that are represented in Williamson County, which is a unique opportunity, and it's certainly part of our vision and mission for this working group. Our goal in each of our working groups is to have about 25% of the members' attendance, and so in that group we would have to grow it by 11 people, and all things are possible with that group. So we're very proud of the attendance of that group. And then the overall attendance in all our working groups for this past 6 months has been something that we're proud of. We have about 82 members that are consistently coming to meetings, and that represents 45 organizations. And these organizations and these members actively participate in our working groups, and several of them meet in additional working groups, more than one. So we have several highlights that the Alliance is very proud of so far in the 6 months, and most of it's due to the kind of hard work and commitment that our members have made to our organization. So far in the last 3 months, including our summit that was held in April, we've had over 23 presentations by organizations and community partners, and I'll talk a little bit about the presentations we've had in the School Health Working Group later. And we had presentations as well at our summit. We have 102 community members that attended our summit in April, and that represented about 60 organizations, and that made it a more fun way to collaborate because we had so many different voices and ideas in the same room. Our support staff has attended, for the Alliance, has attended 21 meetings and 8 outside coalitions. So not only do we hold working group meetings and Alliance activities within Williamson County, but we also attend other coalitions in Williamson County and other communities, as well as coalitions that meet in Austin also. The support staff has presented and trained 330 community members on various topics, especially those related to the healthywilliamsoncounty.org website, our community health assessment, community health improvement plan, our tobacco referral system, and other Alliance educational issues. Another one of our highlights that we're really proud of this year is the fact that we have the West Wilco Community Resource Coalition that has started in the western side of our county. We had members meeting in Taylor. There's a coalition in Taylor, Hutto, Georgetown, and we noticed there wasn't a community resource coalition actively meeting in the western side of the county, which includes the communities of Liberty Hill, Leander, and Cedar Park. We were very proud of the fact that with the sponsorship of the Hill Country Community Ministries, that we could bring this coalition together. It represents many of the community resource and services in those communities, and it's very useful and helpful to our families. We would encourage our school health partners in that area to come to our meetings. We have 29 local agencies and nonprofits in our meetings. They meet monthly at ACC to collaborate and network with each other. So we have those posted, meetings posted on healthywilliamsoncounty.org. It'll be the same place that we post the recording of this webinar, and as well as we have it posted in our newsletter that goes out each month. Now I'm going to turn it over to Melissa, and she's going to talk to you about some of the things that data we've collected so far with the Alliance. Melissa?
Thank you, Ray. So in these past 6 months, we've really been pushing our community resources, specifically our website, healthywilliamsoncounty.org, and Bertha. And I'm just going to talk a little bit briefly. In the past 6 months, we've had over 2,500 users who've viewed over 11,000 pages. And as you can see on the right, the blue line is 2016, the green line is 2017. We really increased our page views, and we continue to hope that we can engage community partners and our community members to use our website. As well, we've been working with our vendors to get current data as well as keep our data updated. Over half of our data has been updated in the past 6 months. Aunt Bertha is the platform we use to search community resources, and we've continued to push that out through our working group meetings as well as other coalitions, and also distributing flyers to places such as the Round Rock Public Library to distribute to the community. And so in the past 6 months, the top 3 searches on Aunt Bertha was actually health, housing, and food, and we can all probably acknowledge that those are important issues in our county. Over 1,200 users have made 6,000 searches. That's about 200 users per month and about 4 searches per user. And so we're just going to now transition over talking about a survey that we distributed that we had asked our members to fill out at the beginning of June. We believe it's important to solicit member feedback as well as capture the hard work that all our working members are doing in the working groups and also outside the working groups. And so I'm just going to talk briefly about the progress that we've made in the past 6 months. And so we've have about 48 members responded to our survey, and you can see that it's a pretty diverse group. We have about half of survey respondents that are new to the coalition, and then about half that have more than 2+ years in the coalition. Throughout our working groups, we've really been focusing, one of the main goals is to increase collaboration and networking and to promote member activities. And so we really wanted to see how many connections have been made through local wellness alliance activities such as working group meetings, the summit, trainings, and we just call those collaborative, we just call those connections. As you can see, about half of our survey respondents said they were able to meet between 1 to 3 organizations through these activities. About 7 said they weren't able to. That's mainly because they either indicated they were new or they would have preferred more active networking, which is what we've begun to do through our working group meetings. The other half were able to make more than 4 plus connections, and that has led over to 36 new initiatives and partnerships throughout all our working groups, and I'm just going to talk a little bit about that and just highlight some of the cool ones that are related to school health. For example, you can see all the way down, it says, I connected with Becky from Georgetown Head Start in the school health group, as well as the kids and car group from Dell's Children. Together, we conducted a car seat safety check event at the Georgetown Head Start location, able to distribute about 25 car seats to low-income families. Additional organizations include Brighter Days Food Pantry, the Round Rock ISD Parent Group, Life Steps, Medical Mission at Home, and Central. Okay.
Go ahead, Melissa.
Okay, next slide, please, Ray. Continuing on, additional stories from our survey respondents. Connected with Ashley King from Texas AHEC East, AAC, we, St. David's, and Williamson County EMS were able to provide a Stop the Bleed class to 24 of our health students. And then there's also additional, I got to connect from Natalie from Cooking with Colors to the Healthy Eating Working Group. I gathered prenatal resources through the March of Dimes in a maternal infant health working group. And additional organizations include AmeriGroup, Head Start as well. Lastly, additional survey result or stories that individuals sent. Catch My Breath e-cigarette program. I met catch representatives at local wellness alliance meetings and found common interest in tobacco prevention. Now I serve on the Catch My Breath steering committee. Also, we're trying to get together an employee wellness group, and we'll be reaching out to American Heart Association contacts. So thank you for everyone that filled out the survey and provided such awesome stories for us to share in our working group meetings. And like I mentioned, we are really trying to promote our community resources, and we really wanted to see how the website has been benefiting our members and how we can continue to improve upon the resources we provide. And so the top 3 benefits of the website include the community events calendar, 2, health and population data, and 3, working group and community group information. And we asked survey respondents to rate how the services we are providing as an alliance, and overall, majority has said that networking and collaboration was the highly rated service. 2 was learning about other organizations, and 3, community health improvement process. And these are things that we will continue to push forth through our working group meetings as well as alliance activities. And so we asked how our members continue to support the alliance, because we believe it's a partnership with our members, and the number one thing that our members said they support the alliance is by participating in our events, which we are really grateful for that. 2 is continuing to promote the alliance in the community, and 3 is accessing community resources. I continue to ask how our members can continue to support the alliance, and which allows us to provide more opportunities for our members. And 1 is promoting the healthywilliamsoncounty.org website. 2 is continuing to participate in the community health improvement process. And 3, promotion of the alliance through presentation. Lastly, we really wanted to know how we can continue to improve the alliance, and the number 1 thing that the survey respondent says was continue to support and promote member activities, events, and outreach efforts, And we will continue to do that through networking opportunities, through a newsletter, through working group presentations, as well as through the tranche process. 2 was to increase networking opportunities, and 3 is to seek funding to support working group activities. So thank you all to those who filled out our survey, and now I'm going to give it back to Ray.
Thanks, Melissa, and I want to echo that. Thanks to all those that are interested in giving us feedback. You know, the Alliance is here to serve you and to serve the communities of Williamson County, and it helps us when we get the kind of feedback from you guys to make it to help meet you all's needs. And so we're very excited when you can participate in that way. So now I'd like to give you a community health improvement plan update, and I think you remember sometimes around January where we came to you and brought you this plan, talked about it as the 2017-2019 CHIP. And this plan is something that we initiated our start in January. We had 3 meetings so far, and we're incredibly proud of the progress that's being made so far. One of the things that, if you look here are all the working groups, the amount of goals. We have 30 goals that all the working groups are working on in the Community Health Improvement Plan. We're very excited and proud of the fact that we already have 58 strategies in progress, which is 64% of the strategies in the plan, and we're only in the first 6 months of the first year. So knowing that we're doing that, we are moving straight ahead and having a better idea of how to impact the community. We're looking for new ways all the time to bring you new tools, new partnerships, new presentations, ways to learn, ways to collaborate, and we certainly can do this if we keep working on our plan. We do have strategies in the School Health Working Group. You all had 9 strategies, and 7 of them are already initiated, and so I'd like to spend a little bit of time talking about the strategies that we're working on and the ones that we can start in the near future. So just to remind the School Health Working Group that the action plan goal was to promote healthy living for the school community to maximize personal success and well-being. And one of the first objectives in this action plan is the awareness of resources. And that is just making the understanding of what resources are available to our schools. Our school partners really have a lot going on, as well as our other agencies in this area. And just our ability to help communicate that with each other is very important. Strategies that were in this area were to look at utilize past needs assessments, evaluate school needs, organize opportunities to share best practices, and identify and promote school community resources. And let's just talk about what we've done so far in this area. We've had the community or the Alliance has attended coalition activities out in Taylor that's working with social emotional learning. We've had participation from the Alliance members on the opportunities for Williamson and Burnett County on their School Health Advisory Council for their Head Start program. The collaborative, the Alliance is also a member of the Interagency County Council that in Eastern Williamson County that provides school health resources. And as I mentioned before, we're part of the Youth Behavior Task Force, as well as part of the Substance Abuse Task Force. In building awareness of resources, we've had several presentations in our school health meetings. Vicki Salinas, parent liaison from Round Rock ISD, presented on Parent University. This is a program that works closely with WCCHD through focusing on family health and wellness needs. For example, they have parents attend food and nutrition classes as well as early literacy classes. We had that presentation in one of our working group meetings. Um, Another place or another objective is sustainability, that the working group will create sustainability by adding more organizations to the working group. And you can already see that we have a lot of members in that working group, so we're constantly trying to find ways to communicate with all the members in the working group. Uh, in the area of strategies, the strategies were to promote school health initiatives, um, um, identify ways to support shacks and present to shacks, recruit diverse organizations that support school health. So some of the things that we've done in this area is this year was a legislative session. So in each one of our working group meetings, we had legislative updates, as well as we emailed those out throughout the months we didn't meet. We also had Jan Pelosi with the Health District, who brought to us an opportunity to share a video on immunization. We discussed about this, and the decision was made to reach out to schools and make this video available to them. And another place that we also discussed is how to get community resources in the hands of our ISDs. And one of the ways we discussed to do that is to go out and present the Aunt Bertha community resource to the ISDs, and so we're planning that for this fall. We are in the process of continuing to grow our alliance, especially in the school health working group area. But I'd like to read out some of the members and organizations that are in this group, and there's really almost too many to mention, but I do want to say that we get consistent representation from these groups. But Texas State University in Round Rock, Department of State Health Services, St. David's in Round Rock. Our Mental Health Task Force has representatives that come to the school health meeting. Dell Children's Medical Center and Dell Children's Health Plan. Dairy Max, It's Time Texas, Opportunities for Williamson and Burnett counties, Georgetown ISD, Leander ISD, Round Rock ISD, Marathon Kids, Catch, the Health District for Williamson County, Texas AHEC East, and Hope Alliance have just been examples of people who have come to these meetings. So if you see other partners that want to come and meet with us, please feel free to have them contact me if they're willing to join into the alliance. Next, we will talk about this opportunity of collaboration, that the School Health Working Group will create solid relationships with these member organizations. Part of that is by getting feedback like we did in our survey, and also planning, having you guys develop your own plan and working your own plan. So in this area, we have actually started all of the strategies in this area, developing networking resources, establishing school health and organizational entry points, creating network experiences, and supporting members' initiatives. And I'll give you an example of supporting members' initiatives. We had a presentation by Mary Sedequist from Seton Williamson to talk to us about medical mission at home. They have aligned this with the start of school. It's going to be held July 29th from 9 to 4 p.m. at Seton Williamson in the Round Rock area, and this is going to offer free health care services to anyone who walks in. They're very much encouraging students, children, and families to show up, but certainly they will certainly take any clients that walk in at that time, and this is a free service. They're going to cover all medical types of screening issues, as well as immunizations and other medical screening opportunities. So we're very excited about Mary giving us that presentation. The other thing that we've been working on is, and we're trying to wait until fall begins, because we're wanting school districts to finalize their managers so that we can put together a school contact list so that we'll know who are those key people who are in charge of health and wellness in each of the school districts in Williamson County. We did have two strategies that we have not yet begun on. We thought we could get started on those at the beginning of the school year, but one of them is identify ways to support shacks and present at shacks. We're very excited because It's Time Texas and the Alliance for Healthy Children in Texas is working on plans related to school health in the areas of shacks. We're excited about working with those partners to see how we can bring that to our schools in Williamson County, as well as the other strategy that we have not had a chance to get involved in yet, but we're actively seeking, is to utilize past needs assessments to evaluate school health needs. So that should be an activity that we would be getting started somewhere either this year or starting it near to the beginning of in January. So as you can see, the School Health Working Group has really been working hard on a lot of different initiatives. Very proud of that progress. It probably has a lot to do with we have such high attendance. We encourage everybody to do that. In fact, speaking of meetings, our next meeting will be in September. It'll be a kickoff meeting for your school year, and so we invite you to come and share what you've learned over the summer and really network with people who are interested in talking to our schools. So this time, I'm going to go ahead and pull all of you off of mute, and then does anyone have any questions or ideas? You certainly could speak now, or you can type it in into the chat bar.
Ray, it's Beth Thorson. I logged on 2 or 3 minutes after the meeting had started. Did I miss introductions?
Actually, Beth, what we did is we're doing it in a webinar format, and so that way.
So I can just look at the list.
Yeah.
Yeah, got it. Thank you.
Minutes that will have everybody that's in on the call. And we will have this posted on the internet so that if anybody wants to share this with others, you can feel free to do this. Any other questions?
Yeah, this is Sarah from It's Time Texas. Can you repeat the information for the Seton Round Rock event?
Yeah, absolutely. And I know Mary's on the call too as well. So we're really excited about this event. And we do have a flyer that we can post, but the Medical Mission at Home is going to be held on July 29th from 9 to 4 p.m. and it's free healthcare services. It'll be at Seton Williamson in Round Rock. Got that, Sarah?
Yes, thank you.
Oh, you're welcome. And then, yeah, I think that's a great idea. Somebody just posted that in September we could do a roundtable where each agency can speak to their initiatives that are new for the school year. That would be super. That's the mindset of a kickoff. So we really like that idea. We certainly think that would be fun on the agenda. And what we'd like to do, maybe, Joanne gave us that from she gave us that from Dairy Max. What would be super to do that is let you guys do that kind of round robin and in fashion, and then do our networking activity after that, because I'm sure lots of people will want to talk to each other after you guys do that. So good idea, good idea. Mary just piped in. She doesn't have a mic, but she's going to send a flyer. Mary, if you would send that to Melissa and I, and then Melissa can include it with the minutes, that would be awesome. Any other questions, ideas?
Hey, Ray, it's Sarah again. When we have things to share, like flyers or anything like that, is it best to just send them directly to you or Melissa, or how should we go about sending and sharing that with the group?
I would say there's two ways to share with the group. Certainly send it to me, and then I can forward it out. some things I do put in the newsletter so that we can share it that way. And I also put things on the community calendar that we have on the healthywilliamsoncounty.org website. And if you would tag it school health, then when people search for school health things, they can find your event there.
Perfect. Thank you.
Welcome. And Melissa has just updated in your chat bar. If you go into your chat bar and you click on the link, you should be able to see the medical mission at home community calendar. I know we have a lot of backpack events going on and different things in different school districts, so feel free to have school districts post that on our community calendar as well, and then we'll approve that. Tag it school health. Other questions? Melissa also posted the calendar link as well. So you guys are great because you always pitch in and jump on the call and participate in the meetings. And so we have some of the most fun with this group. So thank you for participating in discussion as well as going through our presentation today. So next steps, we kind of feel like there's things that we have to do as an organization and as the Alliance and in our working groups. So one of the things we think is going to be real important, and we want to focus in on our school districts in this area, is to promote the use of community resources. We do hear that a lot from the school districts. We started an initiative with Aunt Bertha, which is our community resource directory for the county. We started that initiative with our public libraries, and we also see this as an opportunity for our community service organizations, admin positions in our school districts to use as well. I talked about the community calendar just now, and promising practices is another good place. And I think I've talked to the agencies in the school health group that you guys can post into promising practices. So I would suggest that you go ahead and do that. That way we can get your promising practices, some of the opportunities you have in there, posted on our website. And then I know several of you have grant opportunities. If you have a grant opportunity, send it to me and Melissa, and we can get those posted as well. And I know the schools, I would encourage you to look on the healthywilliamsoncounty.org website in order to find grant opportunities. We have national, state, and local grants listed there, and I know that would be very helpful to you guys. Another thing we'd like to do is update the working group performance measures so that we have measures that go with all of our objectives. We would like to make sure that we are moving in an upward trajectory on those measures. So we'll be working to update that so we can bring it to you at the end of the year. Create a plan to improve member engagement. If there's other ways, and we'll talk about this in our working group meeting, but if there's other ways for us to get together and do that in other formats, we certainly would be excited to do that. One of the great things about the school health group is there's other conferences that happen throughout the year, and I know the school health groups meet in those conferences as well. And then lastly, focus on moving all CHIP strategies started to progress. And we would really like to start the one on shacks. I know Sarah, you guys, and Michelle, y'all are very interested in shacks, and we really would love to open the door to our shacks here in Williamson County and have that opportunity to have a little summit or forum with the shacks and bring your tools, experiences, and expertise to them. So excited about that. I think, school health is near and dear to my heart. That was my background. So we definitely want that to go well for us. So if you have any questions and you feel like you need to email us, our emails are all have changed. They're wilco.org. So just showing you this on the screen. So email us. You'll see Melissa's email as well as mine. And any of our support staff of our working for this working group. So with that being said, I'm going to go ahead and close out